Chronic obstructive pulmonary disease, or COPD, is a lung disease that affects hundreds of thousands of Canadians. But until now, its toll may have been underestimated. A new report released by the Canadian Thoracic Society reveals that COPD causes more hospitalizations in Canada than many other major chronic diseases and could cost the healthcare system as much as $1.5 billion each year. Respirologist Dr. Ronald Grossman treats patients with COPD every day and says what he sees in his practice supports the findings of the new report.
Chronic obstructive pulmonary disease is characterized by narrowing of the airways into the lung. For patients, that translates to breathing through a straw. For patients who have an attack of their COPD and they're not serious enough to require hospitalization, these attacks lead to progressive and accelerated loss of lung function. In patients who get admitted to hospital with an attack of their COPD, the implication is exactly the same as a heart attack. 1 person in 10 will die when they're hospitalized, and if they survive their attack and live a year, 1 person in 4 will die at the end of a year.
The growing hospitalization rate for COPD comes as deaths from coronary disease, stroke, and hypertension have fallen dramatically over the past 40 years.
We're hopeful that this report will be a clarion call, a wake-up call to patients, physicians, and the healthcare system that we need to really pay attention to COPD. It's an important disease. It's a leading cause of hospitalizations in Canada. There's a significant morbidity and mortality associated with it. It's the only chronic disease that we know of where mortality rates are rising. We need to do better for these patients.
COPD affects both men and women, is growing in prevalence, and is now the 4th leading cause of death in Canada. The disease has a debilitating effect on a patient's quality of life. Judith Farley knows all too well the impact the disease has had on her health since being diagnosed 2 years ago.
When I was first diagnosed with COPD and told that my oxygen levels were such that I would now have to be on oxygen 24 hours a day, I was really shocked. I've had many flare-ups. Some have been non-hospitalization, some have been hospitalization, the worst, of course, being the pneumonias. The last one I had was actually just a week ago, and it was a much more serious in that it was almost complete respiratory failure.
COPD is preventable and treatable, but remains largely undiagnosed. Treatment can include smoking cessation, physical activity, pulmonary rehabilitation, and medication.
We try to prevent lung attacks by ensuring that patients are optimally managed when they're not sick. We ensure that they have appropriate vaccinations. We ensure that they are on the right medication and they're using it in the proper method. In addition, it's important for patients to know the first or the early signs of an exacerbation or lung attack so that they can take appropriate measures at an early step. We know that if appropriate therapy begins early, that the severity of a lung attack can be minimized.
Spirometry is a simple test and the best way for a doctor to check your lung health. People can lead long, active lives with COPD if it's detected and treated. Learn more about how to manage your lung health at lung.ca.